After confirming its first case of the new coronavirus, South Korea is stepping up precautionary measures. Lim Yun-suk explains.
Local health authorities are struggling to keep the fast-spreading COVID-19 under control, with officials ramping up efforts.
President Moon Jae-in met with members of his cabinet during an emergency meeting today. There, he also sat down with regional authorities to discuss response measures to contain the coronavirus.
오전 10시 기준 코로나19 감염자는 2,931명이며 27명이 완치되어 태어나셨고
South Korea has now tested more than 196,000 people, but we are not anywhere close to that. They started conducting drive-through testing, but people here in the United States can't even get tested by their own doctors.
South Korea was one of the earliest countries to be affected by COVID-19, with the first case announced on January 20th, 2020. On February 19th, the number of confirmed cases increased by 20, and then again to reach a total of 243 cases by February 21st. As of May 9th, however, South Korea has managed to contain the spread of the virus and continues to record very few cases. Students prepare to return to school in May, and normalcy has begun to return to the country. But just how was South Korea able to successfully contain the virus? W.h.o, a 57-year-old Chinese woman, was selling shrimps at the Huanan seafood market on December 10th when she developed a cold. Believing it to be the common flu, Wei went to a local clinic for treatment where she was given an injection. However, Wei continued to feel weak and visited 11th Hospital in Wuhan a day later. On December 16, Wei visited Wuhan Union Hospital and was told that many other people had visited after attending Huanan Market with similar symptoms. Wuhan Municipal Health Commission confirmed Wei was among the first 27 patients to test positive for COVID-19 and one of 24 cases directly related to the market. The World Health Organization's China office first heard reports about the virus we now know to be COVID-19 on December 31st, 2019.
China has reported a 50% rise in the number of people who've died of COVID-19 in the city of Wuhan. It's a major revision of its data. The total number of confirmed deaths in China, now more than 4,500, which is an increase of more than 1,200.
While the Chinese government responded to the initial outbreak by placing Wuhan and nearby cities under a de facto quarantine, people who had already contracted the virus managed to leave China and make their way to South Korea. On January 20th, the first confirmed case of COVID-19 in South Korea was a 35-year-old Chinese woman. 3 days later, the first Korean national, a 55-year-old man who worked in Wuhan and returned to South Korea for a checkup, was confirmed to be infected. Following this, there was another confirmed case on January 26 and again on January 27. 2 more cases were then confirmed and reported on January 30th. The 5th patient was a 32-year-old South Korean man who returned from his work at Wuhan on January 24th. However, the 6th patient was the first case in South Korea who had never visited Wuhan. The 6th patient, a 56-year-old man, became infected with the virus when visiting a restaurant with the 3rd patient. On February 18th, the number of COVID-19 cases in South Korea would rise exponentially following the 33rd case originating from a member of the Shincheonji Church of Jesus in the city of Daegu. The Shincheonji member, a 61-year-old woman, had initially visited a hospital following a traffic accident. The next day, she developed a sore throat and a fever. Despite her symptoms, she continued to attend church services, spreading the virus to hundreds of other churchgoers, as there were at least 1,000 members present during one of the days she had attended. Due to the spread, the woman was instructed by medical professionals to undergo testing for COVID-19, but she was insistent that she did not have connection with any infected individuals and had not visited China within recent months. As this occurred, reports investigated by authorities claimed that Shincheonji Church maintained operations in the Hubei province of China, where Wuhan is located. The Shincheonji Church instilled strict guidelines for its members. Illness was not considered to be an acceptable reason to be absent during worship. If an attendee were to be ill, they should still appear at service. If they were too under the weather to attend that day, they would have to attend the following day or the day after in order to make up for the time lost. Church attendees were also instructed not to be afraid of illness. The spread of COVID-19 amongst Shincheonji members was only heightened by various worship requirements. Attendees would sit closely together and were not permitted to wear glasses or face masks, causing them to be more susceptible. As of March 24th, there were 5,066 cases of COVID-19 that had originated from the Shincheonji Church of Jesus. Due to the spread, South Korea held the highest rate of infections after China, averaging at hundreds of cases per day. As South Korea is a small country, the existing infection rate caused COVID-19 to advance even more quickly.
In the following episodes, we will analyze how South Korea effectively contained the virus, and to help us better understand, we contacted several individuals living in Seoul.
I'm Mona Lisa Hansen from Seoul Cosmetic Surgery. Seoul Cosmetic Surgery is a licensed medical tourism agency here in Seoul, Korea.
My name is Martha. I'm originally from Poland. I've been living in Korea for the last, give or take, 12 years. I am a startup community builder and ecosystem developer.
My name is Hyungwon. I'm Korean living in Seoul. I'm a grad school student in history faculty.
The world was shaken by how rapidly the virus could spread between groups of individuals.